Hi, my name is Sajad Sabor, medical student from Denmark, presenting you medicine and in-depth videos about certain drugs. And today we'll be talking about the well-known drug Isotretinoin. When we're talking about Isotretinoin, we're actually also talking about Accutane or raw Accutane. Note that I'm not trying to sell anything, nor do I get commission for the things I mention in this video. So, what is Isotretinoin? Isotretinoin is a retinoid, a subtype of vitamin A, and the structure is very much alike, but their mechanism in the body is of course different. Isotretinoin is used as a medical drug for severe acne cases, and in some special cases it is used for skin cancer and other skin diseases. As you can see, it's mostly related to the skin. So, what does Isotretinoin do? The exact mechanism behind Isotretinoin is not fully known, since it does various things, but on the other hand, a lot is known when applying it for patients with severe acne. That means when I'm explaining to you guys what the drug does, I am specifically reflecting it to the acne cases. But before that, I'll have to explain you to the basic anatomy of the skin, so you'll have a better understanding of what the mechanism is behind Isotretinoin. So what we're looking at now is a hair follicle, and as you can see just a little below to the epidermis, also called just the skin surface, you can see a sebum gland. The sebum glands in our body moisturizes the skin with an oil substance, and it's very much genetically coded, which essentially means that some people produce a lot of sebum and some produce less sebum than normal. High production of sebum can lead to greasy skin, and low production of sebum can lead to dry skin. As you can imagine for yourself, both are problematic. When the sebum is produced, it heads towards the exit, to the skin surface, where it can flatten out. However, if the skin surface is blocked due to bacteria or other structures blocking the way, it will become bigger and bigger, creating a yellow round-like structure, which we call acne. Isotretinoin comes in handy because it induces apoptosis in certain cells, which just means that it programs certain cells to kill itself or die out. That's what the apoptosis essentially means. And in this case, we are actually talking about the sebum cells. So when the sebum cells dry out, there is no sebum to moisturize the skin, and it will therefore become very dry, and other moisturizing methods will be needed. Unfortunately, we can't control specifically which cells to kill and which to keep alive. Isotretinoin, as mentioned earlier, kills certain cells related to the skin. However, there are also other unrelated cells that dies out. Here under the meibomian cells, which are essentially the glands that moisturizes the eye surface. And these are actually just one example. Should you use Isotretinoin? It wouldn't be morally correct if I were here to judge whether you should or you shouldn't, since I'm not a doctor, simply a medical student. However, Isotretinoin works well and is a very successful drug if other medications hasn't been working for acne. Although be aware of the side effects, which we are going to talk about now. There are some usual side effects that comes with any drugs given, and it would be stupid for me to clarify every single side effect that comes with Isotretinoin. So I'll just mention the most common ones. Although I do recommend that you look this up yourself, since I believe Wikipedia has some information about it, or you can use your own country's medical services. So the most common side effects are of course dry lips, dry eyes, dry skin, dry muscle soreness, weakening of the muscles, and thrombocytopenia, which reduces the clotting process when, for example, getting a wound. So the less normal side effects are dry nose, harder to breathe through the nose, hypoglycemia, which actually just means high blood sugar, headaches, and high protein amount in your urine. So the less normal side effects are, the unusual side effects are the most serious ones, and they occur 1 in 1,000 patients. It includes depressions, suicidal thoughts, induces aggressivity, hair loss, and blood in the urine. There are some warnings and cautions before taking Isotretinoin, or when taking Isotretinoin. Firstly, all the side effects mentioned just earlier are dependent on so many factors, including ethnicity, age, weight, and dosage. Other things to mention is that you should not at all costs intake Isotretinoin while pregnant. Another thing to be aware of is your alcohol intake. Isotretinoin is taken or metabolized by the liver and will slightly damage the liver. But luckily for us, our liver is a regenerative organ. However, intaking a lot of alcohol at the same time will cause liver dysfunction. Lastly, remember not to train with heavy weights, since Isotretinoin does have an influence on the muscles, making them slightly weaker and fragile. So if you're interested in me doing an Isotretinoin course video, just comment below or private message me. I'm happy to do it, but because one of my relatives has taken the medication and has taken several pictures of the course. How do you get Isotretinoin? Well, I can't actually know for sure about the United States, but in Denmark, where I live, they are very strict about the drug. You'll first have to go through a doctor who will most likely give you a prescription for other acne products, and once you return to the doctor and tell them that the medication haven't been efficient, that's where he will allow you to visit a dermatologist. The dermatologist will then assess the situation and prescribe you the Isotretinoin. And once you accept this, you'll have to take a blood test for each month to perhaps compare the different results and to see if your liver is still normal functioning. That is how the drill goes in Denmark. I believe in other European countries it's quite the same. Thanks for watching, like and subscribe if you're interested in more medical related videos. Also private message me if there is a certain drug type you would want me to make a video on. Bye.